Well, I continued to read scientific journals, medical journals, chemistry journals, all the journals, because by then I decided that bodies aren't made out of drugs. What a decision. And that if there was something the matter with the body that did not require surgery, because of course surgery is very important. Hey, if I get run down by a truck, does it matter whether it's a white bread truck or a whole grain truck? No, I still need a surgeon. But if I'm going to eat the stuff, it might make a difference if it's white bread or whole grains. So for things non-surgical, I studied biochemistry, and particularly the biochemistry of the human body, because if there's something the matter in there and it doesn't require surgery, it just makes sense that if we work with the things out of which the body is made, that maybe it'll just all repair itself. You know, that worked a lot. So that's what I focused on. Clinic started in Kent, and there were 2 or 3 locations in Kent, Washington. That's Washington State, not Washington, D.C., folks. And then moved just 2 years ago up here to Renton. So actually it was in various locations in the city of Kent until 2002. We do just about anything that doesn't require surgery we can work on here at the clinic. For example, we have a women's health department now in which there are 2 practitioners, mostly focusing on the use of bioidentical replacement hormones. Everyone probably remembers the big fuss 2 or 3 years ago about how, oh my goodness, horse hormones don't belong in people. They might hurt people. They belong in horses. Duh. That only took 40 years to figure that out. Now, what we've been using since 1982 are hormones that are exactly identical to what belong in women's bodies. What a concept. But it took until 2002, 2003 for that to get popular. And as you know, there's now a book out there by a famous Hollywood actress talking about how she's using hormones that are identical to human. Well, again, we've been doing that for 23, 24 years, and have not only been asking folks to consider those hormones if they're going to consider hormones, that is, ones identical to ones found in the body, but we also are very careful to do measurements to find out if we've got the right type of hormone, the right quantity of hormone, the right timing of the hormone. Is very, very important to follow that for safety's sake. Well, we've got actually a small division of the clinic that does that now, and it's 2 women, of course, because if it's women's hormones, it just sort of makes sense that it be women practitioners.